A little cough may be the least of the worries of these villagers, and yet it's the biggest concern of aid workers. It could be a sign of the coronavirus, a threat these villagers fleeing attacks from armed groups have not heard of until they arrived at this food distribution center, where extra precautions are being taken.
Our habits have changed because of this disease. Now we wash our hands more regularly with soap before eating or drinking. We strictly follow the sanitary rules that they taught us to avoid the spread of the virus.
Next to this relief center is an international gold mining operation, where there are a number of infected workers, but production hasn't stopped. The value of gold is rising. With so much uncertainty in the global market, traders are investing in gold, and Burkina Faso is one of the world's biggest exporter. But it has little to show for all the wealth created. Burkina Faso has just 11 ventilators for 20 million people and is ill-equipped to deal with the outbreak. Hospitals and clinics are closing down after threats of attack by an Al-Qaeda affiliate in the Islamic State in the Greater Sahara. Two groups which have stepped up their operations despite the pandemic. The few hundred doctors left are abandoning their posts, leaving the people of Burkina Faso alone to deal with a virus that's rapidly spreading.
Burkina Faso is a ticking time bomb. This crisis is revealing how fragile, vulnerable and weak some countries in West Africa are during a pandemic. More specifically, the Sahel countries faced with the challenge of armed groups.
The United Nations is calling for a global ceasefire so countries like Burkina Faso and its people, crushed by the violence of armed conflict, hunger and poverty, can better fight a virus that is quietly gaining ground. Nicolas, Haque, Al Jazeera.